Sometimes my anxiety is so bad that I have to skip school. You know what else isn't fun? Anxiety. A simple definition of generalized anxiety disorder is severe ongoing anxiety that interferes with everyday activities like skating, boarding, and being cool.
To be a little more specific, it's characterized by an almost constant feeling of being on edge. You're worried, but you can't give a name to what it is you're worried about. It's story time, fellas, so buckle up. This one time, before I knew what the disorder was, my dad tried to sit me down and explain the probability of bad things happening. But a brain with GAD isn't predisposed to accept those explanations because it wants to worry about everything all the time. Some ways that you can tell when anxiety is acting up is if you get shaky hands, or you start sweating a lot all of a sudden, or you become uncomfortably aware of your heartbeat, and often that's anxiety giving you two options. You can either go to bed immediately, or you can run 40 laps around the block. The onset for this disorder is later than most, with the median age being around 30 years, but actually the symptoms might manifest earlier in life through a more anxious temperament. It's usually not diagnosed until after adolescence, though.
Over 25% of American teens have a diagnosable anxiety disorder at some point in their life. That means 7 of you guys.
As the population ages, the prevalence of anxiety also increases. I guess you accumulate more things to worry about as you get older. And the most common group to have GAD is older women. It's most prevalent in the white American population, followed by Hispanic American, African American, then Asian American. It's also very highly genetic, meaning if a member of your family has it, you're also pretty likely to get it.
You've got mail!
Oh boy!
In addition to genetic factors, environmental factors like childhood abuse or prolonged exposure to stressful situations can greatly increase your chance of developing GAD at some point. The brains of people with GAD have abnormally low levels of serotonin and norepinephrine. Meds can be used to help.
The most common med used to treat anxiety is the SSRI, or selective serotonin reuptake inhibitor. They stop your neurotransmitters from taking away all that good serotonin, so you feel happier and you have more time to skate. Usually the goal of meds is to see a 70% increase in day-to-day functioning. Some common SSRIs are Lexapro, Zoloft, and my favorite of all, Paxil.
Meds are also commonly paired with cognitive therapy, using techniques such as stress inoculation training that aims to help the client think more rationally through anxiety-inducing situations. However, it's not always as easy as it sounds.
Sometimes, trying to live with generalized anxiety disorder is a little bit like skateboarding in the grass. Your cool white sneakers are gonna get messy and nobody's happy. Same thing goes. Anxiety is often accompanied by depression or substance abuse. One type of depression is seasonal affective disorder, or SAD. Look at how cloudy it is. How can you be happy in this weather? A lot of people use therapy lamps to deal with it, and they're really bright. They're so bright I feel like I'm growing leaves. I'm gonna show you how bright it is. So the next time a buddy tells you they've got anxiety, here are a few things you might want to keep in mind. Number 1, it's more common than you think it is. Number 2, yes, they've probably already tried to stop worrying about it, and probably yoga, and tea. Number 3, if anything, you can always offer to listen. Number 4, if they don't want to talk about it, that's okay too. Just be the best friend you can be in the context of the situation.
In all seriousness, though, it's important to understand that anxiety and depression are debilitating conditions that can often cause you to forget to take basic care of yourself. Knowing that, please do your best to stay informed and help your friends stay cool.